Okay, well welcome. Tonight, as we break ground for the Mark Lipschutz Center for Nutrition and Family, we mark an important moment in the trajectory of our organization. I want to thank all of you for coming on this balmy summer evening, but it's not as hot as we initially thought it would be. But one of the things that our journey began in 2001, and our new friends who are joining us tonight for the first time, welcome. I also want to thank our friends who were not able to be here with us tonight, but will be joining us via Facebook Live. Tonight, you will learn more about exactly how this building will help countless people in New Jersey and beyond, and how we as an organization are honoring Mark Lipschutz's memory through his ambitious project. But before I go any further, I want to acknowledge the Lipschutz family. Rachel, who serves on the board of trustees of our organization. His son Jason, welcome Jason. Jason's wife Dia, and his brother Rich, and his mom, his sister-in-law Risa, unfortunately were delayed, 4-hour delay at the airport, so they may get here a little later, but they're here, we know, in spirit. And, Mark's daughter Jessica and Danielle, Danielle's husband Matt, and Mark's dad Herbert are unable to join us in person tonight, so they are watching our live stream, and we send our regards to all of them. So one of the things that we wanted to also say is that tonight is a significant moment for us. Our vision for this project, it dates back to 2013, but since that time, the need for this project has grown dramatically. Understanding nutrition is a significant issue for people with cancer, and there are few resources available, and fewer, if any, that are professionally led and offered free of charge. We envisioned a space that would enable us to provide hands-on nutrition education and counseling for people with cancer and their loved ones, helping them to embrace healthy eating, including increasing their intake of foods to help them fight cancer, based on the guidelines by the American Institute of Cancer Research, with whom we partner. We participated in innovative national research proving that a three-pronged approach, evidence-based education, hands-on experiential learning, and social and emotional support to cope with the impact of a cancer diagnosis resulted in a statistically significant increase in knowledge as well as behavior change in just 8 weeks. We received early support from the Trustees Family Foundation and others, so when we approached the Lipschutz family to get involved, we had no idea that not only would Mark and Rachel make a substantial commitment themselves, but that based on Mark's wishes, their family and friends would get involved so that the building would bear Mark's name. I want to thank everyone here who answered Rachel's call and helped us to make this dream a reality. With the support of the Trustees, the Lipschutz family, the Gladys Group Foundation, and many other individuals, donors who saw our vision, we secured enough funding to engage Gensler, a world-renowned architectural firm, who learned the project, and of our campaign co-chair, Dan Laughlin, who is also a trustee of our organization. The Gensler team asked us what we would do if we had a functioning lower floor of the building. And as the staff eyes widened, plans were put in place to add the stepping stone clubhouse to the structure. This offhanded question from Gensler enabled us to dramatically increase our ability to address the needs of the whole person and their entire family. The Stepping Stone Clubhouse was named by our friends at PVH. It was originally a mobile clubhouse developed by the students at Pingree and funded by PVH, and it turned to the Dodie Laughlin Wellness Center, affectionately known as the Barn, into a space for children facing a cancer diagnosis or that of their family member. Thanks to the Dorothy Hirsch Foundation, we are adding a permanent kid-friendly space where our child life specialists will deliver programs and social activities to kids of all ages where they can meet one another so that they don't feel alone, and again the life skills needed to move through a health crisis. The Stone Clubhouse will support all of the children in our program, even those who cannot join us in person, by acting as a hub for all of our activities. And then came COVID-19. Our plans were moving along, and we were inching closer to our $1 million goal for the building, and that's when our world, just like everyone else's, was turned upside down. But our campaign committee persevered, led by Dan and Kevin Kelly. They kept moving forward. We realized, though, that we needed to develop a broadcast capabilities in both the Lipschutz Center and the barn so we could reach people who can't get to our community in Bedminster. Amy will talk with you shortly about the other half of the campaign, another $1 million that has been raised that will fund and why this broadcast is especially important to our capabilities. It is more critical than we ever originally envisioned. But these decisions were made as our organization's footprint was growing throughout New Jersey and beyond. This groundbreaking, in some ways, is a combination of such, and yet it's just the beginning. There's a team of experts in all aspects of building and technology who are looking at each component of this project and guiding us to make the Mark Lipschutz Center for Nutrition and Family, together with the Dodie Laughlin Wellness Center, the hub of our evidence-based, life-altering work, and a place of community and connection for all people, young and old, who are going through a health crisis. And at this time, I'd like to welcome Crossroads for Hope phenomenal leader, our CEO, Amy Sutton, who will talk about our work and what it means to the people we serve. Amy?
As I look out at all of you, I'm struck by how each one of you has helped make this groundbreaking possible. As Ralph mentioned, it took us many years to get to this point, and your commitment to our vision of becoming the safe space to turn first when there's a cancer diagnosis is why we are here. On behalf of the Board of Trustees, staff, volunteers, and all those we support, I want to thank all of you for your continued support. As our organization grows and expands its reach to meet the ever-increasing and complex needs of people with cancer, caregivers, and their loved ones, we will never forget where we came from. Our founders, Lynn Arnold, Nancy Dowd, Eunice Jadlocke, and Ann Brown, had both professional and personal experiences with cancer. Their belief that the social and emotional support is an essential part of cancer care that should be available to all people facing cancer, regardless of where they are on their journey, and that it should always be free of charge, was way ahead of their time. It really was groundbreaking at the time. So to realize their vision in 2001, they created an independent 501c3 called Hope Springs, and were guided very early on to affiliate with a national organization whose program model was groundbreaking at the time when it was developed in the 1970s. But the world has changed dramatically, as we've all seen. Over the last 10 years, we've been working diligently to transform our capacity and capability to respond to the ever-increasing challenges facing cancer patients and their loved ones, including cancer care that has become highly specialized, complex, and costly. The traditional psychosocial support models in operation today are often limited and fragmented. They have historically put the burden on individuals and families to source what they need and deserve, and the standard of care that they should expect. We needed to be able to move beyond our walls on this campus to reach all those in need in relevant ways that break down barriers to care, that can impact a person's quality of life, and in some cases, life expectancy. which is why in 2020 our Board of Trustees voted unanimously to end our national affiliation, and in February 2021, we became Crossroads for Hope, a network of cancer support. So I just want to talk for a moment about some of the initiatives that the campaign, beyond the capital piece of this, but the programmatic campaign, which was to raise $1 million, has helped us to do. It has helped us to really integrate child life, registered dietitians, and public health professionals onto our interdisciplinary team, which already consists of social work and other allied health and mental health professionals. And so by having those staffing resources, we've been able to innovate and create relevant programs in each of those areas. And I just want to talk for a moment about some of that, because a lot of it's playing out in terms of our actual outreach into the community. So we are leveraging public health to incorporate the community voice within diverse communities and vulnerable communities into our programs and the programs that we are developing. We're working to develop trusted partnerships in these communities where we can help to activate champions and making sure that we can help to implement our Gladiator program, which will enable us to transfer critical skills and knowledge to individuals in these communities to become first responders when they become aware of somebody affected by cancer. This is innovative, and we want to move beyond just dealing with the issue of the disease in these communities to dealing with people and their needs and opening up doors and access to care. Underpinning all of our work is technology and our MyGo2 support program. So through our digital web-based mobile engagement program, we are able to chat directly with individuals and provide access to a digital library of resources that is available 24/7. We are providing a personalized cancer support experience delivered where and when patients need it most, to themselves and their loved ones. This is a backbone of our program, and in addition, we're able to screen for distress on a regular basis, as well as needs that they have individually. So now we're in a position to proactively deal with barriers to care that people face each and every day. And we saw this in action during Hurricane Ida. Within hours, 24 hours of that storm, we were able to push out messaging directly to 600 of our members, many of whom were already at shelters, to provide access to our social work and child life team for assistance. And that led to us being able to further use our public health team to then reach out to another 1,600 people to make sure people had the resources that they need. So with all this emphasis on our outreach and creating points of access into the community, you might be wondering why this building, the Mark Lipschutz Center for Nutrition and Family, is so important to our trajectory as an organization. And the answer is simple. A key word in this new building's name and a key word in the Jody Laughlin Wellness Center is the name center. As the footprints of many nonprofits grow, they add locations as part of their expansions. Oftentimes, it's hard to sustain that. Quite honestly, we will not be doing that. This is the center where we will be able to execute our programs with the infrastructure and the space and the human capability that we need to deliver helpful programs and resources to people affected by cancer. So in addition to the $1 million that was raised for this building, we raised another $1 million for staffing and programmatic needs that will allow this building and our work to reach its full potential. With the combination of the efforts that we've been talking about and the MyGo2 support program and the broadcast and reporting capabilities that the Lipschutz Center will have, we will be able to reach anyone who needs us, anywhere and at any time they need our help. Our vision was to provide technology in the palm of your hands. People will carry us wherever they are, whenever they need us. And that vision and that reality was made only possible because of your support. I'm also pleased to announce that a month ago, we received an incredibly generous gift from the Margaret A. Darren Charitable Trust that will allow us to hire the registered dietitian that will be operating out of this facility and to direct the programming that is needed across all areas of our programming to make sure that nutrition is part of everything that we do. We've also been able, due to this generous gift, staff another child life specialist, and we will be hiring a bilingual social worker as well to help us in our outreach efforts. And a true testament to the Darren Foundation's belief in what we're doing, they added in their gift $100,000 towards our endowment to set us up for the future financially and ensure that we are sustainable for the long term for the people who need us most. I feel like I've said so much, and I know there's so much I need to say, but this night is about Mark and the Lipschutz family and everyone who supported us as we've raised actually $2.5 million against our goal of $2 million. So I think without further ado, we need to break some ground. So I would ask the Lipschutz family, Ralph, Kevin,
Yeah.